Start by redefining hypersexuality. It's not just about having a high libido or being impulsive. Instead, hypersexuality can be a survival response, a way the brain adapts to unsafe or unpredictable environments. For many survivors of trauma, sexual behaviors that seem bold or excessive on the outside may actually be attempts to regain a sense of control or safety. These actions aren't about desire, but about coping with deep, unresolved feelings and needs. Understanding this shift in perspective is crucial because it helps us see these behaviors not as flaws but as creative survival strategies. As we move forward, we'll explore how the brain's wiring and past experiences shape these responses. Hypersexuality is often misunderstood as a sign of strong desire. In reality, it's more about the brain's need for safety. When someone grows up in an environment where they feel unsafe, their mind develops unique ways to cope. Sexual behavior can become a tool for managing anxiety, regaining a sense of power, or even distracting from emotional pain. This isn't about pleasure, it's about survival. By recognizing this, we can approach survivors with more empathy and less judgment. Next, let's look at what happens inside the brain when trauma shapes sexual behavior. Trauma doesn't just affect our emotions, it rewires the brain. The amygdala, which is responsible for detecting threats, can become overactive after trauma. This means the brain is always on high alert, searching for danger even when none is present. In this state, sexual behavior can offer a brief sense of relief or control. For some, it's a way to soothe the nervous system or escape overwhelming feelings. Others may use it to feel powerful or wanted, filling gaps left by a lack of safe emotional bonding in childhood. Biological sensitivities like ADHD or bipolar disorder can make these patterns even stronger. Let's see how these brain changes influence the push and pull of intimacy. Emotional needs and safe touch are missing early in life. The brain looks for substitutes. Sexual behavior can become a stand-in for the comfort, connection, or affection that was lacking. This isn't a conscious choice, it's a survival adaptation. The body and mind crave what was missing, and sometimes sexual activity is the only way the brain knows to get those needs met. This can be confusing for survivors, who may not understand why they're drawn to certain behavior. Recognizing this pattern is the first step toward healing. Next, we'll explore the internal conflict survivors often feel about intimacy. Survivors of trauma often experience a confusing push-pull when it comes to intimacy. On one hand, they may desperately crave connection and closeness. On the other, they might feel intense fear or even disgust at the thought of being close to someone. This isn't about sending mixed signals, it's the brain's way of protecting itself. Sometimes saying yes to intimacy is a way to stay safe, not a sign of genuine desire. The mind wants connection, but the body remembers danger. This internal conflict can be exhausting and difficult to explain, but it's a natural response to past trauma. Survivors say yes to intimacy, it's often a protective strategy. Agreeing to something can feel safer than saying no, especially if saying no has led to danger in the past. This is not about true consent or desire, but about survival. The brain is trying to avoid conflict or harm by going along with what feels safest in the moment. Understanding this can help us see survivors' choices in a new light. It's not about mixed messages, but about deeply ingrained survival instinct. Next, we'll look at how trauma responses show up in the nervous system. Trauma can push the nervous system to extremes. Some survivors experience hyperarousal, feeling constantly on edge, ready to fight or flee. Others may shut down, feeling numb or disconnected from their bodies. Both responses can show up around intimacy. Hypersexuality and repulsion aren't opposites, they're two sides of the same survival coin. The brain is trying to keep the person safe, either by seeking control or by avoiding danger altogether. These patterns can repeat over time because predictability, even if painful, feels safer than the unknown. Why do survivors repeat the same patterns even if they're harmful? The answer lies in the brain's need for predictability. Trauma teaches the brain that the unknown is dangerous, so it clings to familiar behaviors even if those behaviors cause pain. Hypersexuality and avoidance can become predictable ways to manage overwhelming feelings. This isn't about pleasure or desire, but about feeling safe in a world that once felt out of control. Recognizing this helps us understand why change can be so difficult for survivors. It's important to remember that survivors aren't broken. Their brains and bodies have done exactly what was needed to survive. Hypersexuality, avoidance, and other trauma responses are creative adaptations, not signs of weakness or failure. By shifting our perspective, we can offer survivors compassion instead of criticism. Healing begins with understanding and acceptance, not shame. Next, let's talk about how survivors can move toward healing and reclaim their sense of safety. Healing from trauma-linked hypersexuality starts with compassion. Survivors need to know that their responses made sense in the context of their experiences. Therapy, support groups, and safe relationships can help rebuild trust and teach the brain new ways to feel safe. It's a gradual process and setbacks are normal. The goal isn't to erase the past, but to create new patterns that prioritize safety, connection, and self-acceptance. Let's look at some practical steps survivors can take on their healing journey. One of the most powerful tools for healing is building safe, supportive relationships. These connections help survivors learn what healthy intimacy feels like. Over time, the brain can start to relax and trust again. This doesn't happen overnight, and it's normal to feel scared or unsure at first, but with patience and support, survivors can experience intimacy that feels safe and genuine. Next, we'll discuss the importance of self-compassion in the healing process. Self-compassion means treating yourself with the same kindness you offer a friend. For survivors, that can be especially challenging, but it's essential for healing. Recognizing that your responses were about survival, not failure, can help reduce shame and self-blame. Small acts of self-care like rest, healthy boundaries, and positive self-talk can make a big difference. As survivors practice self-compassion, they begin to rewrite the story of their trauma and reclaim their sense of worth. Triggers are reminders of past trauma that can cause intense emotional reactions. Understanding what triggers hypersexuality or avoidance can help survivors prepare and respond with compassion. This might mean avoiding certain situations, practicing grounding techniques, or reaching out for support. Over time, learning to recognize and manage triggers can reduce their power and help survivors feel more in control of their responses. Healing also means redefining what intimacy looks and feels like. For some survivors, this might involve setting new boundaries, exploring non-sexual forms of closeness, or learning to trust their own feelings. Intimacy doesn't have to be scary or overwhelming. With time and support, survivors can create relationships that feel safe, respectful, and fulfilling. This new definition of intimacy is built on choice, not fear. Summary: hypersexuality is not a sign of brokenness or excessive desire. It's a complex survival response rooted in the need for safety and connection. By understanding the brain's adaptations to trauma, we can approach survivors with empathy and support. Healing is possible, and it begins with compassion for ourselves and for others. Remember, every survival response was once a way to stay safe. With time, understanding, and support, new patterns can emerge that honor both safety and genuine connection.